Acute abdomen. Imaging investigations. Ultrasonography, plain X-ray, contrast studies, tomography, computed tomography, and guided aspiration or biopsy. Plain X-ray. Supine and upright abdominal and chest to view the outlines of the kidneys, the ureters, bladder, liver, spleen, psoas, and peritoneal fat lines. Gastric small and large bowel gas patterns. Pneumoperitoneum, pneumobilia, radiopaque shadows, gallstones, feculates, and calcification in soft tissue masses. Pneumobilia, pneumoperitoneum, air under the diaphragm. Distal small intestinal obstruction. Low small intestinal obstruction. Dilated intestinal loops in an infant with calcified meconium deposits after intrauterine rupture. Multiple prostatic calculi. Bilateral ovarian dermoid cysts showing teeth and fat. Calcified dead pig worm, Dracunculus medicinensis. Crohn's disease of the terminal ileum with a string sign caused by diffuse narrowing. The string sign is caused by incomplete filling of the intestinal lumen. It results from irritability and spasm associated with severe ulceration. In such cases, the string sign is most frequently seen at the terminal ileum. Crohn's disease of the terminal ileum with a string sign caused by diffuse narrowing. Right suprarenal mass pushing the right kidney downwards. Calcified left suprarenal gland. Contrast and scanning studies. Barium swallow, barium enema, intravenous urography, intravenous cholangiography, liver scanning, ultrasonography, CT scanning, and MRI. CT imaging of a liver abscess. Translucent gallstones on oral cholecystography. Stones in common bile duct. A scarce worm in the common bile duct with a T-tube cholangiography. Barium sulfate inside the hepatic abscess communicating with the duodenum. Neurofibroma presenting as a filling defect in the third part of the duodenum. Right ganglioneuroma compressing the upper pole of the right kidney. Notes on the radiological studies. Differentiation between the distended small and large gut might be difficult in some situations. Correlation with the clinical sign is important. Rarely, swallow of meglumine that is weight gastrografin might be indicated to confirm or exclude high intestinal obstruction, gastric or duodenal perforation. Barium enema is avoided in cases of acute abdomen and peritonitis. Barium enema is rarely needed to diagnose diverticulitis, sigmoid volvulus, low partial colonic obstruction by carcinoma, and angiography to diagnose rupture of solid viscera like the spleen or kidney. Angiography may be the only way to diagnose subcapsular or central hepatic rupture. Mesenteric angiography is done to locate the sites of massive lower gastrointestinal hemorrhage. X-ray, ultrasonography, CT scans, or MRI diagnose abdominal tumors. Important note, large soft tissue masses, metastatic testicular carcinoma, and other malignant abdominal tumors undergoing necrosis may simulate an acute abdomen. Many types of vasculitis may cause abdominal pain simulating acute surgical abdominal diseases. Sometimes vasculitis may involve the appendix or small bowel. Surgery is mandatory in this condition. It may be diagnosed on histopathological examination of the surgical specimen. In most cases, careful examination shows no evidence for a progressive intraperitoneal lesion. Establishment of the diagnosis by muscle or skin biopsy. Osteoarthritis with compression of the thoracic and spinal nerves may produce severe ill-defined abdominal pain simulating abdominal lesions, particularly biliary colic. Some degree of involuntary rigidity of the rectus muscle is an additional point of confusion. Careful analysis of the pain nature, radiation, and hyperesthesia are differentiating factors. Radiological investigations for differentiation. A spinal cord tumor may cause radiating pain simulating biliary or renal pain. Good luck and best wishes.